And welcome back. Now, it's been 2 months since the labour sector partnered with the Department of Health in its efforts to strengthen the response towards screening for TB, HIV and diabetes in the workplace. Now, 3 trade unions in the mining, retail and agriculture sectors launched the Qina Msebenzi Uphile campaign, which aims to reach thousands of its members to be tested, educated and also enrolled into treatment programs. Now, to give us an update on this initiative, we're joined now by Amanda Mkizwana, who's Cosatu's Gender Coordinating Committee member in Gauteng, and also alongside her is Mabalane Mfundisi, Project Director at the Qina Msebenzi Uphile campaign. Thanks so much for making the time this morning.
It's our pleasure.
So perhaps we can just start by going a few steps back and just talking to the rationale of this initiative and also what you are hoping to achieve. Let me start with you.
Well, it's in line with the National Strategic Plan on HIV, TB and STI led by the South African National AIDS Council. Every 5 years we develop a plan, what we need to do as a country to push back against the, new infections and what do we do with those that are infected. One of the sectors is the labor sector, and we sat together and we said it is important for labor unions, including their federations, although they might be competing for members, but one thing they agree on, that we need to contribute towards eradicating HIV, TB in our community. So they all agreed, we came together and we said, what are the things that we basically need to do as a contribution towards realization of the objectives of the National Strategic Plan. So the National Lotteries Commission, through the South African National AIDS Council, came on board and supported us, because these things also cost money to go to the communities. And but the champions of this process is the labor federations, who are saying our members, we cannot have a workforce when we have a sick workforce. So we need to get to them, engage with them constantly to be contributors in the response. And
you say it costs money. Mabalane, where does the money come from?
The money comes from the taxpayers. It also comes from the National Lotteries Commission, who have, when the National AIDS Council approached them, they saw fit that whilst they support many other contributors, they need to ensure that they support labor. There's a notion that labor unions have money, but when you get on the other side of the fence, you realize that the conditions are very different. Membership has gone down. So whilst they do a bit with what they have, an injection is always welcome.
Amanda, with regard to numbers, I mean, what are the objectives? How many people were you hoping to reach, and how many have you managed to reach thus far?
We had a program in August 21 and 22 of August for the Checker Impilo. So our target was the workers on the first day, and the second day was the taxi industry and the hostel. So the program was very successful, whereby 762 people that tested, and we distributed 1,300 female condoms and 60,000 male condoms. And also it was also the part of recruiting Sakau. We recruited 71 members, which was very good. And the response from the taxi industry, we didn't know that taxi industry are health conscious, because they were interested in how to use the female condoms, because they are used on the male condoms. So the response was very positive. And the main purpose that we start with the workers on the first day, because we wanted the companies to comply in terms of having agreements that talks to HIV and AIDS, to address the issue of stigma and people that are defaulting, so that they can have a relationship with the local clinics, so that when they go to the clinic, they will get an attention, so that no one will be late at work, because some of the workers, they default because they find that they are choose in the clinics, but when there's a good relationship in the local clinics, it makes things easier. And also healthy workers, it's good that, because at the end of the day, the economy will go down if they are not productive at work. So it assisted to address the issue of stigma and address discrimination, because some are being discriminated, and the companies also should have a role to play where they must support the workers, because both we are want to achieve the production. So the production is in 2 weeks.
And then perhaps just Mabalane, how aware are people, of their health in these sectors that you are actually targeting, which is retail, mining and the agricultural sector? Amanda speaks about her surprise to the reaction from the taxi industry, but in the 3 sectors that you are targeting, how aware are people?
Well, people are aware. One of the debilitating factors that makes people not to take up services, the issue of stigma and discrimination. And with the unions, we're saying, let's deal with the mindset. Let's create conducive conditions for people to understand that in this country we have 8 million living with HIV or, who are said to be HIV positive. Millions, about 4 million people are already on treatment. We're also responding to the president's call through the Cheka Impilo campaign to have 2 million additional new people on treatment. So we're engaging with them, and the best way is to get the shop stewards, because on an ongoing basis the shop stewards and the workers, they engage on issues around labor, and therefore part of the engagement should also include issues around health, issues around HIV, not being afraid. So when the leaders are out there, it's not just about pricking a finger and saying follow me. It's getting through people's mindset, because there are also mental health issues that come with people's discovery of their status and how they will be affected. So we all are aware, but now it's dealing with the finer details, the granular details that make sure that in the same way that we see diabetes, we must then see HIV. But what we're also saying is, in our understanding, we must also not be encouraging people to be infected. So prevention becomes important, because we must deal with the 8 million that we have, ensure that they are on treatment, they are retained, and push back that there shouldn't be any new infections. There are there is this concept of older men and younger women, with over 1,700 young women being infected every day. And we're saying, workers, you have money. Make sure that you don't misuse that money by creating conditions that result in young women being infected. So it's now those things that we're dealing with, that we must change our mindset, accept, and do the things that they require us to do.
Indeed. We're out of time, but just finally, where will you be doing your testing next?
The next test we're targeting the farm workers in the Western area.
Farm workers in the West Rand area. So if you are in that area and if you work in that sector, be on the lookout for it. Thanks so much to Amanda Mkizwana, Cosatu's Gender Coordinating Committee member in Gauteng, and Mabalane Mfundisi, Project Director of the Qina Msebenzi Uphile campaign, talking to us about their goal to reach as many workers to test for HIV and TB and create awareness in the workplace. Let's take a break.
Thank you.